What if the medical test you trust most could be silently harming your health? Today, we're discussing 6 common medical screenings that seniors over 70 should carefully consider before agreeing to them. I'm here to share evidence-based information that could change how you think about routine health care. Recent medical research shows that approximately 40% of diagnostic procedures performed on adults over 70 may provide minimal benefit while creating significant risks. The uncomfortable reality is that our healthcare system often applies a one-size-fits-all approach to medical screening, regardless of age, health status, or individual circumstances. What works for a 50-year-old may not be appropriate for someone who's 75. Before we dive in, I want to hear from our community. Drop a comment letting us know your age, location, and whether you've ever questioned a medical test your doctor recommended. Have you experienced unexpected complications from what seemed like routine screening? Your stories help others make informed decisions. Remember to subscribe and hit the notification bell for more evidence-based health content. Now let's examine these 6 screenings, starting with one that might surprise you. Our 6th concerning screening is routine prostate cancer testing through PSA blood tests for men over 70, particularly those without symptoms. The prostate-specific antigen test measures a protein produced by prostate cells. Elevated levels can indicate cancer, but they can also result from benign enlargement, infection, or even recent physical activity. Here's the issue. After age 70, the likelihood of detecting slow-growing prostate cancers that will never cause harm increases dramatically. Meanwhile, the treatments often cause significant side effects, including incontinence, erectile dysfunction, and bowel problems. A comprehensive analysis published in the New England Journal of Medicine followed 76,000 men for over a decade. The study found that PSA screening in men over 70 prevented approximately 1 death per 1,000 men screened, while subjecting hundreds to unnecessary biopsies and treatments. Consider Robert, a 72-year-old retired mechanic who felt perfectly healthy. His annual physical included a PSA test that came back slightly elevated. This led to a prostate biopsy, which detected a small, slow-growing tumor. Despite the urologist's assurance that watchful waiting was an option, Robert chose surgery out of fear. Post-surgery, Robert experienced permanent incontinence and depression. 2 years later, pathology reviews suggested the tumor was so slow-growing it likely would never have affected his lifespan. Robert wishes he had chosen active surveillance instead of immediate intervention. The American Urological Association now recommends against routine PSA screening for men over 70, especially those with limited life expectancy. For men in this age group who are considering screening, the decision should involve detailed discussions about individual risk factors, life expectancy, and personal values. Alternative approaches include focusing on symptom monitoring, difficulty urinating, frequent nighttime urination, or pelvic discomfort, rather than routine blood testing. These symptoms warrant evaluation, but asymptomatic screening may create more problems than it solves. Number 5 might shock you. Routine cervical cancer screening through Pap smears for women over 70 who have had normal results throughout their lives. Cervical cancer screening has been one of medicine's greatest success stories, dramatically reducing cancer deaths in younger women. However, continuing this screening indefinitely may not make sense for older women with consistently normal results. The American College of Obstetricians and Gynecologists states that women over 65 who have had adequate prior screening with normal results can safely discontinue cervical cancer screening. Yet many women in their 70s and 80s continue receiving annual Pap smears. The concern isn't just unnecessary procedures. It's the cascade of interventions that can follow. In older women, the cervix changes naturally, sometimes making test results difficult to interpret. This can lead to false positives, requiring additional testing, biopsies, and anxiety. A study in the Journal of the American Medical Association tracked screening outcomes in women over 65. Researchers found that continued screening in low-risk women led to a 13-fold increase in unnecessary procedures without preventing a single case of invasive cancer. Meet Patricia, a 74-year-old grandmother who had received normal pap smears for 40 years. During a routine gynecological visit, her new doctor performed another pap smear that showed atypical cells. This triggered a colposcopy, followed by a cervical biopsy. The biopsy results were benign, but Patricia experienced bleeding and infection that required antibiotics and additional visits. The entire experience caused months of worry for what turned out to be age-related cellular changes that posed no threat. For women over 70 with a history of normal screening results, the risks of continued screening often outweigh the benefits. However, women with previous abnormal results, those who never received adequate screening when younger, or those with compromised immune systems, may still benefit from continued monitoring. The key is individualized decision-making based on personal history, risk factors, and life expectancy, rather than calendar-based automatic screening. Coming in at number 4, routine mammography screening for women over 70, particularly those with limited life expectancy or significant health conditions. Mammography has undoubtedly saved lives by detecting breast cancer early in younger women. However, the benefit-to-risk ratio changes significantly after age 70, especially for women with other serious health conditions. The primary concern is overdiagnosis, detecting cancers that grow so slowly they would never cause symptoms or death during a woman's remaining lifetime. Studies suggest that up to 30% of breast cancers detected through screening in women over 70 fall into this category. Treatment for these slow-growing cancers can include surgery, radiation, and hormone therapy, all carrying risks that may exceed the cancer's threat. For elderly women with limited life expectancy due to heart disease, diabetes, or other conditions, breast cancer treatment complications can be particularly dangerous. Research published in the Annals of Internal Medicine analyzed mammography outcomes in women over 75. The study found that for every 1,000 women screened annually for 10 years, approximately 7 lives were saved, but 60 women experienced false alarms requiring additional testing, and 13 underwent treatment for cancers that would never have caused problems. Consider Eleanor, an 78-year-old woman with diabetes and heart disease, who continued annual mammograms despite her declining health. A screening detected a small hormone-positive tumor. The recommended treatment included surgery and 5 years of hormone-blocking medication. Eleanor chose treatment, but the anti-estrogen medication worsened her bone density and contributed to a hip fracture. The surgery recovery was complicated by her diabetes, requiring extended hospitalization. Looking back, Eleanor questions whether the treatment improved her quality of life or longevity. Current guidelines from the U.S. Preventive Services Task Force suggest that mammography decisions for women over 74 should be individualized based on overall health, life expectancy, and personal preferences. For women with serious health conditions that limit life expectancy to less than 10 years, the risks of screening may outweigh the benefits. Alternative approaches might include clinical breast exams and patient education about concerning symptoms rather than routine imaging. The goal shifts from detecting every possible cancer to maintaining quality of life while addressing only clinically significant disease. Number 3 on our list, routine thyroid function testing in asymptomatic seniors, particularly the overuse of thyroid hormone replacement therapy based on borderline test results. Thyroid function naturally changes with age, and what might be considered abnormal in a younger person may be completely normal for someone over 70. Yet many seniors are prescribed thyroid medications based on laboratory values alone, without considering symptoms or overall health status. The most common issue involves subclinical hypothyroidism. when TSH levels are slightly elevated, but thyroid hormone levels remain normal. In younger adults, this might warrant treatment, but in seniors, it often represents normal aging rather than disease. A major concern is overtreatment with thyroid hormones, which can cause heart rhythm problems, bone loss, and anxiety in older adults. The cardiovascular risks are particularly significant for seniors who may already have heart conditions. The Journal of Clinical Endocrinology published a comprehensive review showing that treating subclinical hypothyroidism in adults over 70 provided no benefit for symptoms, quality of life, or cardiovascular outcomes, while increasing the risk of atrial fibrillation by 24%. Take Harold, a 73-year-old retired teacher who felt fine but had routine blood work showing a slightly elevated TSH level. His doctor immediately prescribed levothyroxine, explaining that his thyroid was underactive. Within months, Harold developed heart palpitations and couldn't sleep through the night. His bone density scan showed accelerated bone loss. When he sought a second opinion, the endocrinologist explained that his TSH level was within the normal range for his age and recommended discontinuing the medication. After stopping the thyroid hormone, Harold's symptoms resolved, and his follow-up testing showed stable thyroid function. He learned that his original TSH level was likely normal for a man his age and that treatment was unnecessary. The American Thyroid Association now recommends more conservative TSH targets for adults over 70, suggesting that levels up to 7.0 millimicro international units per liter may be acceptable in asymptomatic seniors, compared to the traditional upper limit of 4.5 milli international units per liter used in younger adults. For seniors considering thyroid testing, the key questions are: do you have symptoms of thyroid dysfunction, such as unexplained fatigue, weight changes, or temperature sensitivity? If not, routine screening may create more problems than it solves. Our second most concerning screening: carotid artery ultrasounds in asymptomatic seniors, often performed as part of vascular screening packages or stroke prevention programs. Carotid artery screening uses ultrasound to detect narrowing in the neck arteries that supply blood to the brain. While this sounds logical for stroke prevention, the reality is more complex, especially for people without symptoms. The major problem is that most carotid blockages discovered through screening don't require intervention. Studies show that asymptomatic carotid stenosis, even when severe, rarely leads to stroke when managed with medication alone. Meanwhile, the surgical procedures often recommended can cause the very strokes they're meant to prevent. Carotid endarterectomy, the surgery to remove plaque from carotid arteries, carries a 2 to 3% risk of stroke or death even in the best surgical hands. For asymptomatic patients, this risk often exceeds any potential benefit, especially in seniors with limited life expectancy. A landmark study in The Lancet followed over 3,000 patients with asymptomatic carotid stenosis for 10 years. The research found that modern medical management, including blood pressure control, cholesterol medications, and antiplatelet therapy, was as effective as surgery for preventing strokes without the surgical risks. Consider Frank, a 76-year-old who participated in a heart health fair at his community center. The free carotid screening showed 70% blockage in his right carotid artery. Despite having no symptoms, no dizziness, vision changes, or weakness, he was referred to a vascular surgeon who recommended immediate surgery. Frank underwent carotid endarterectomy but suffered a stroke during the procedure, leaving him with permanent left-side weakness and speech difficulties. In hindsight, Frank wishes he had sought a second opinion and considered medical management instead of rushing into surgery. Current guidelines from the Society for Vascular Surgery emphasize that asymptomatic carotid stenosis should primarily be managed medically, with surgery reserved for very specific, high-risk cases in younger patients with long life expectancy. For seniors considering carotid screening, important questions include: do you have symptoms suggesting carotid artery disease? Are you healthy enough to benefit from potential interventions? Would you choose surgery if blockages were found? If the answer to these questions is no, then screening may create anxiety and lead to unnecessary procedures without improving outcomes. Our most concerning screening for seniors: lung cancer screening with low-dose CT scans, particularly for older adults with significant health conditions or limited life expectancy. Lung cancer screening with CT scans has been promoted as a breakthrough in early detection, and for some people, it genuinely saves lives. However, the screening also detects numerous false positives and slow-growing cancers that may never cause problems, especially in very elderly patients. The screening process involves annual CT scans for people with significant smoking histories. While this can detect cancer early, it also exposes patients to radiation and often identifies lung nodules that aren't cancer but require months or years of follow-up testing. Most concerning is that lung cancer screening can lead to invasive procedures, including biopsies and surgery in patients who may not live long enough to benefit from treatment. For seniors with heart disease, chronic lung conditions, or other serious health problems, the treatment complications may be worse than the cancer itself. The National Lung Screening Trial, which established the benefits of CT screening, primarily included healthier individuals aged 55 to 74. The benefits for older, sicker patients remain unclear, yet many seniors in their late 70s and 80s continue receiving screening recommendations. A concerning case involves Margaret, an 82-year-old former smoker with chronic heart failure and diabetes. Her doctor ordered lung cancer screening just to be safe. The scan showed a suspicious nodule, leading to a PET scan and eventually a lung biopsy. The biopsy showed early-stage lung cancer, and Margaret underwent surgical removal of part of her lung. However, her recovery was complicated by her heart condition, requiring weeks in the intensive care unit. 6 months later, Margaret's overall health had declined significantly, and she questioned whether the treatment extended or diminished her quality of life. Current screening guidelines recommend stopping lung cancer screening when patients have limited life expectancy or wouldn't be candidates for treatment due to other health conditions. For seniors over 75, the decision requires careful consideration of overall health status, not just smoking history. The key questions for older adults considering lung cancer screening include: are you healthy enough to undergo treatment if cancer is found? Would you choose aggressive treatment given your other health conditions? Do you understand that screening may detect cancers that wouldn't affect your lifespan? As we age, medical decision-making becomes increasingly complex. What benefits a 50-year-old may harm a 75-year-old? The goal isn't to avoid all medical care, but to choose interventions that genuinely improve quality and quantity of life. Before agreeing to any screening test, consider asking your doctor these key questions. What happens if the test is positive? What are the risks of follow-up procedures? How will this change my treatment or quality of life? Am I healthy enough to benefit from early detection? Remember, you have the right to decline any medical test or treatment. Sometimes the most courageous choice is saying no to procedures that may cause more harm than good. Focus on maintaining your health through proven strategies: staying physically active, eating nutritiously, managing chronic conditions, and maintaining social connections. These lifestyle factors often provide more benefit than endless screening tests. Thank you for watching. Share your thoughts and experiences in the comments below. What screening decisions have you faced, and how did you make your choices? Your insights help others navigate these complex decisions. Don't forget to subscribe for more evidence-based health content, and remember, the best healthcare decisions are informed decisions made in partnership with trusted medical professionals who understand your individual circumstances and values.